Well, it's summertime here. Yes, it is time to start applying the sunscreen every day, but with such a wide range of choices, how do we know which types are best? Skincare expert Angela Fraser has a few ideas and joins us now. Great to see you. The difference between sunscreen and sunblock, then?
A sunscreen is a product that basically works by absorbing or filtering the UV rays, and these tend to be chemical ingredients, and that's why we hear that we have to put them on 30 minutes before going out in the sun for those chemical ingredients to work. A sunblock, on the other hand, like the name suggests, creates like a protective barrier or a coating on the skin. And they're almost bouncing the rays off the skin.
So is one more effective than the other?
The sunblock is going to give you more instant protection and more broad spectrum. They use ingredients such as zinc, titanium dioxide, so they are giving you more of the broad spectrum protection.
But not doing much for the moisturisation and overall skin care?
That kind of depends what they're mixed with. And these days, sometimes you may have a product that contains zinc, but it also contains a moisturiser or a hydrator for dry skin. So it depends on the other products that are put in with the preparation.
We hear a lot about UVA and UVB.
Yes.
So explain the difference here.
Okay. UVB rays, if you think of the sun and you've got the rays coming off the sun, UVB rays are the shorter rays, so they cause most of their damage in the outermost layers of the skin, and they're very seasonal, so they're more dangerous during our sort of 10 to 3 sunlight hours, and they cause sunburn and they cause skin cancers. UVA, on the other hand, are the longer rays, so they penetrate deeper into the skin, so they can be causing a lot of significant damage in those deeper layers, and that cause ageing. So these are our vanity rays, so wrinkles, pigmentation, loss of elasticity, but they also do cause the skin cancers. The thing that I think people forget about UVA is it's constant throughout the year, and it gets through glass and cloud, which is why we get a lot of damage in New Zealand on the right side of the face and our right hand because of driving. And I always say to my patients, just think about UVB for burning and UVA for ageing, and of course both for cancer.
So everybody should use some kind of skin cream then every day to protect against sun rays 24/7, almost 12 months of the year.
Absolutely. And in winter it's really looking at areas that are exposed, of course, like face and neck and hands.
The back of hands, yeah.
Absolutely, with the driving. But I say every single day, like brushing your teeth, don't leave the house, put it on for that protection. We
always see, of course, SPF factors, sun protection factors. I was talking to Pippa before. We probably became aware of this concept, I don't know, around about 20 years ago. And in those days, the numbers were very low. Yes. SPF 4, SPF 6, 7. Yes. Nowadays, it's 30 and then and beyond. But is SPF a bit like the Richter scale? It doesn't necessarily go in a straight line all in one direction? Does it flatten out a bit?
Yeah, it's interesting because really if you look at the SPF, what it's looking at is burn time. So it's telling you if your normal burn time, if you stepped out in the middle of the day, was 10 minutes, if you put an SPF 15, you're getting 10 times 15, so 150 minutes. And SPF 30, 10 times 30, so it's telling you how long you can stay in the sun before you're going to burn. It's a guide, but it's not really talking about total protection. And that's why we need to look at ingredients. So although an SPF 30 will give you twice the length in the sun as an SPF 15, it's not giving you twice the protection. And once you go from like an SPF 30 to an SPF 50, you're looking at an increase from, say, 97% protection to 99%. So there's actually not a lot. It's just about the length of time you can stay in the sun before burning.
All right, Angela, thanks very much for joining us this morning and clarifying a few things. I know that some medical experts have had a rethink about the impact of sun on our skins and that we should still get plenty of sun for the overall good of our health, the vitamin D, etc., but still, we have to protect ourselves against the rays, particularly with New Zealand's position on the planet, eh?
Absolutely.
Yeah. All right, Angela Fraser, thank you very much.
And I think the amount of exposure you need to the sun is just so minimal for the vitamin D, it's almost insignificant.